our first speaker, Tania Maria Villanueva Cabello, who is a research fellow on well-being at the Institute for Advanced Teaching and Learning at the University of Warwick in the UK.
Thank you so much, Kamakshi. Good afternoon, everyone. And as Simon Kamakshi kindly mentioned it, I work at the University of Warwick on United Kingdom as postdoctoral research fellow for the Erasmus Plus HealthyMindEd Project, which is funded by the European Union and which promotes or intend to promote healthy digital teaching and learning on higher education. Today, I'm really happy to talk more about this project. Next, please. So, this project is the HealthyMindEd Project focus on well-being of students and educators in higher education within the context of the digital environment. So, overall well-being is conceptualized as a multidimensional construct accompanied by cognitive, emotional, physical, and social aspects in which they are heavily influenced, as we know, by digital practices that in turn can shape the mental well-being and the social interaction or the social well-being. So it is something of concern, truly concern for institutions, universities, internal development, and their contribution to social development in their local region, particularly among their staff and students. So, in the context of student well-being, we know really well that the high student well-being correlates with a range of positive outcomes, such as better academic performance, increased engagement, enriched life experiences, and even we know that it is a predictive indicator of future academic and professional success and professional outcomes. So well-being for students, it's a really, really important and matters. So in the context of a higher education. Also, with this on mind, it's really important, imperative for the future of the education to ensure that higher education institutions serve as platforms not only for knowledge or of the dissemination of the knowledge, but also to conform an holistic student well-being and a holistic student experience accompanied by the improvement or the support of the well-being of the students. Regarding staff well-being, well, we know that educators' well-being also it's important itself for them and for their performance as well, for their academic development. But also, of course, they are entitled to maintain good well-being, but also their well-being carries an additional significance due to its potential impact on students. So if, for example, educators are overworked with a huge amount of workload, they are highly stressed or experience burnout, this is likely to have a negative impact on the students. There is clear evidence, there are a lot of research that the relationship between the academics and the students is a key factor in student learning, their achievement as well, and the student well-being. So research also suggests that when students perceive that the lecturers or the teachers, their educators, are available or engaged within their classes and interested in them as individuals, this also increase their sense of belonging, confidence, and again, their well-being. Next, please. Thank you. So with this in mind, and in addition to the factors that I mentioned it briefly before, like the workload, the stress, the assessment, and finances as well, the research also indicates that teaching practices in learning environments play a key role in personal well-being and students' ability to improve, to flourish, and become engaging citizens as well. So research also highlights the health risk associated with excessive sedentary behavior, uh, such as exacerbated behaviors that are promoted by digital learning practices in European higher education institutions. Therefore, the mental well-being issues, the social isolation in online learning environments presents as well major challenges. I mean, additional to the challenges that are perceived itself within the academic environment for both the students and educators. And these challenges underscore sustainability concerns within itself the higher education institution. So additional research highlights that there is a connection between organizational factors and student and teacher, for example, burnout. And this emphasizes the urgent need for a deep understanding of these dynamics across various cultural contexts, of course, which could include the role of the educators, the position of the educators, the status of the educators. As well, we are trying to highlight that a better understanding of how the digital environments affect the overall well-being and how to prevent this possible impact. Of some frameworks, for example, for student and staff well-being, as well as practices for like the institutions try to improve the practices for student access, for the student retention, attainment, progression, and they try to develop them. Also, there is still a missing, or there remains a need for immediate interventions to address particularly the stress and emotional exhaustion and the promotion of good practices for the mental well-being, for the physical activity and physical well-being, social well-being. And we know that to achieve this, we need policies, practices, and support services that we require and must be considered for both student and staff, but also from both the student and staff perspectives at the time that we want to create those policies and practices and support services. Meaning that the options and needs for these groups needs to be here. I mean, it is really important to hear their voices in order to understand their needs. Therefore, I think it's crucial to enable a good dialogue on how to create and sustain learning environments and a good curricula that foster well-being, positive digital learning experience for both students and educators. Next, please, Shiri. Thank you. Well, with the expansion of the digital learning in higher education, which was increased following the COVID-19 pandemic, we know, and there is a lot of evidence regarding the impact on the well-being of the academic community, particularly within educators and students. However, how the well-being is impacted after this emergency still remains limited. So research conducted during the high or during the peak of the pandemic indicated that the abrupt shift to online learning negatively affected well-being, resulting in outcomes such as stress, anxiety, depression, insomnia, burnout, and often this drives or it is being driven by an hyperconnectivity and reduces social interaction, as we may all know. So, as expected, since the COVID-19 pandemic, both the well-being, both the students and educators, the teaching staff, has become increasingly prominent area of interest in higher education, particularly for the institutions who wants to provide with well-being support to these groups, to these cohorts. So empirical, again, evidence from this period, I mean, post-pandemic suggests that the abrupt shift to online education exposed both the students and teaching staff to conditions that negatively affect their well-being. So it's basically a lot of evidence that the well-being is being affected by the new digital practices that are started or were potentiated after pandemic. So the prolonged exposure to virtual environments during this time has been linked to an increased emotional burden, again, associated factors with this hyperconnectivity and difficulties in the time management, and again, reduced social interaction for both groups, which in turn impact their social well-being. So while these emergency era studies provide valuable insights, there's still a crucial gap that remains regarding well-being in the post-pandemic period, defined as the transition from the emergency remote teaching to more structured digital modalities. Next, please. Thank you. So that said, this project, the HealthyMindEd Project, aims to develop a high-performing digital education ecosystem that builds capacity in critical understanding of impact of digital education on social, mental, and also physical well-being among both educators, teachers, and students. This project aims or will be enabled higher education members to enhance their digital learning and teaching competences. And with education members, I refer to educators and students, as well as develop awarenesses and practical skills for creating digital learning environment and that promotes all these aspects. So as I mentioned, well-being is or should be approached from an holistic way, an holistic manner. So this will impact all the areas of the target groups, which are the educators and students, from the academic, professional, and social lives, and as well aims to provide with an improvement on the digital learning practices to the institutional and societal domains of European higher education institutions. These areas at the end will be addressed through the research-based project. We aim to create a research-based project and the development of an interactive online platform, policy recommendations, and a comprehensive dissemination strategy. Next, please. Thank you. So the objectives for this project. So one of the objectives of this project is to increase the knowledge and awarenesses of well-being in digital education. And as digital education, we understand, for example, that blended learning, live online sessions, virtual realities, these are among the digital education approaches. And among these teaching staff, students, higher education, and decision makers at local, regional, and European levels. So we want to create awareness about the well-being impact or the well-being importance while working on digital environments for both educators and students. So to achieve this, we will create a research-based report that synthesizes findings from a broad review of international research, together with insights from focus groups and surveys conducted across all partner organizations, highlighting that as partners, I meant to say that different groups, different countries are involved in this project, and I could mention United Kingdom, Germany, Spain, as Belgium, as where our partners are located. So this report will provide with a comprehensive overview of the current state, the needs, and existing approaches to mental, physical, and social well-being among teaching staff and students in the European higher education institutions. Another objective for this project is to equip the higher education educators and students with innovative teaching and learning approaches, with best practices and purposeful insight or purposeful methods. Uh, we think that this will be achieved by providing a policy recommendations and compiling a repository of successful case studies and examples from institutions that have effectively incorporated exercise and movement into their online teaching methods. So creating a valuable collection of good practices, these policy recommendations will be created, and using as well insights from previous research findings and our empirical study. For the support of this objective, an interactive online platform and community of practice will be also designed and launched to raise awareness and promote mental, physical, and social well-being strategies to both, again, students and staff within the digital education landscape. This platform will serve as dynamic hub where both educators and students can access to select methods, to understand the best practices and resources among the digital environments in order to improve their experience, to improve their collaboration, the engaging discussions related to mental, physical, and social well-being within, again, the digital teaching and learning environment. The next, please. Thank you. Okay. And I will show you some results that were from this project. I divided the results in part 1 and part 2. So to achieve the objectives of this project, and as previously I mentioned it, although the emergency era studies provide valuable insights, I mentioned it as well that there is a crucial gap remain regarding the well-being in the post-pandemic period, which is defined as the transition from the emergency remote teaching to the more structured digital modalities. We think that it's important to highlight that we are not working in exactly the same digital environments as during the emergency. So as first step in the research area of the project, a scoping review was conducted to synthesize current research on student teaching staff well-being in these digital environments. So this scoping review is currently undergoing on peer review, and this review adheres to the preferred reporting items for the systematic reviews and meta-analysis extension for scoping reviews, which is the PRISMA SCR guidelines. So this systematic research, the systematic searches were conducted in 4 major databases: the Medline, the Scopus, the Web of Science, and the ERIC, in basically covering studies publishing from January 2021 to February 2025. And the data extraction was independently conducted by 2 reviewers, Juan Pablo Sanabria and Helena Ventil, by using a standardized template. The search strategy was developed using terms identified by the research team and previous systematic reviews and meta-analysis on digital education among students and teaching staff. Next, please. Thank you. And the search strategy for this scoping review use the PEO, which is the Population Exposure Outcome Framework, and the parameters were focusing on higher education, students and teaching staff as population, as you can see in the table, exposed to various forms of digital education. This was the exposure, and the reporting well-being outcomes as outcome. So only post-pandemic studies were included, those collecting data after the most restrictive phase of COVID-19 and reflecting structured digital or hybrid models. Also, only studies conducted in post-pandemic settings were included in this scoping review, and they were defined as those in which the data collection occurred after the most restrictive phase of COVID-19 and educational experiences were which were no longer conditioned by pandemic-related limitations and adaptation. A detailed inclusion and exclusion criteria are presented in this table, as you can see. Thank you. Can we move to the next, please? Thank you. And as you can see in the table, as a result of a systematic research across 4 databases, where we identify 5,493 studies, and after removing 3,270 duplicates, we remain with 2,007-ish items for a title and abstract screening. Of these, 2,679 were excluded for not meeting the inclusion criteria, and the full text of the remaining 47 studies were then assessed for eligibility. And a total of 36 studies were excluded from for the following reasons. 25 did not correspond to the post-pandemic eligibility period. 4 didn't meet study design criteria. 8 did not address the outcomes of interest. 2 were inaccessible, and 1 lacked complete of the statistical information. So across these 7 included studies, which are shown in the table, a range of digital learning environments like synchronous, asynchronous, and hybrid were examined in relation to the students' well-being and experiences with the digital education or digital environments. These studies... Yes.
Excuse me, Tania, just to give you a notice that we have about 2 minutes left.
Okay.
Maximum. Thank you.
Thank you. So these studies varied in sample size, educational context, digital tools use, and well-being outcomes assessed. So overall, can we move to the next one? Overall, our observations, and it's a matter of time, as I would like to show you more results, I can inform you that overall the observations and conclusions from this scoping review were as follows. Digital education in the post-pandemic period was associated with moderate physiological, psychological, and emotional burden among students, which was influenced by individual and environmental factors. And these findings highlighting the need for higher education institutions to implement targeted strategies to promote well-being in digital education settings. And further research, of course, is needed to explore the well-being challenges associated with various digital formats, as well as strategies for managing well-being in the context among both the student staff well-being. As part 2, and as I rush to complete this section, and following the recommendations and observations from the scope review, in this next stage of the research, we decide to explore the well-being experiences of the students and teachers in the digital environments using a mixed methods approach. To achieve this, we conducted a student and educator surveys hosted in Qualtrics to obtain both qualitative and quantitative data. In addition, we ran some focus groups with both cohorts to gather for the qualitative data. So across both methodologies, the questions focus on the impact of digital tools on well-being, as well as the institutional or other forms of support available for the development and use of digital provision in teaching and learning practices. And next, please. Thank you. And At this point, we gather some information, and the results I will show you, it's about the educators survey. And again, due to time constraints, and as we are still under the process of data analysis, I will show you these educators survey results. So we have also the corresponding with slightly different questions for students. And according to the survey data that we obtained 206 responses, and after applying eligibility and screening criteria to our sample, which consists only of educators who have used digital learning tools and are affiliated with European institutions. We found in the survey, or we tried to understand the survey about participants' demographic questions, about trying to understand our sample, including, for example, we asked them about the country, the presence of the having a disability or impairment, the university status for educators, or, for example, the year of study for students. And you can see in this slide the scales that we use. Thank you, Sherry. And in this slide, you can see how the sample is. So through demographics, as you can see, we can learn more about the sample, and in the future, of course, conduct a comparative analysis and evaluate factors, for example, which variables could impact the well-being if this is indeed affected. In the left graph, you can see that 206 participants are mostly educators based on UK, Spain, and Germany, followed by Italy, Belgium, and other countries, with one participant each from France, Denmark, Romania, Turkey, and Croatia.
I'm afraid, Tania, we have to stop here
Okay.
because our second speaker,
Sure.
just to keep on time.
No problem.
Thank you. Our second speaker is Martina Natalini from All Digital, and she will also talk about their project on well-being. Please, Martina, the floor is yours.
Yes, thank you. Hello, everyone. I will share my screen. Okay. Oh, one second. Okay. So, can you see my screen, right?
Yes, we can see your screen.
So, hello, everyone. I'm Martina, and I'm working for All Digital. All Digital is a membership organization based in Brussels, and we have more than 120 members. And we are focused on developing digital skills from basic and access to digital to advanced skills and upskilling. I'm currently working on MindFuard Project that is closely related to HealthyMindEd Project, and is also an Erasmus Plus project. And today I would like to give you a brief overview of the project, what we have done so far, and the next steps. So the project is about mental health prevention in higher education settings. And we want to promote a culture of care and well-being, combining research, training, and digital tools. Our target groups are university students of all ages and study levels, academic and teaching staff, administrative support staff, and mental health and well-being officers. We have three main objectives. The first one is strengthen mental health first aid capacities. The second is reduce stigma and promote early intervention in academia. And the last one, of course, is help to build an inclusive academic environment. We also have three main results. The first is a guide for staff and educators. The second is an interactive training program and for students and staff. And the third one is a virtual reality platform for the training delivery. As a first concrete result, all project partners carry out national research where they analyze existing policies on mental health, conducting surveys, and organize focus groups with university students and academic staff. The fundings from the 5 partners countries, so from Ireland, Greece, Netherlands, Cyprus, and Belgium, were then consolidated into a transnational report. And one of the most important fundings of the report is that none of the partners countries reported the existence of a unified mental health first aid policy covering both the students and staff. And while different initiatives, of course, exist at the national or institutional level, mental health first aid remains fragmented and unevenly implemented. And of course, this fragmentation limits the effectiveness of mental health prevention measures. We also, with the report, we also identify some key challenges, like stigma concerning mental health issues, like I said before, the lack of formal mental health first aid frameworks, so the fragmentation of policy around mental health in academia, the under-resourcing of counseling services, a lack of mental literacy and digital exclusion, including the low digital literacy and limited access to digital interventions, and finally the staff burnout and the high workload. We also identified 3 types of gaps in mental health first aid that we can divide in 3 categories. The first category is about gaps among students, then gaps among staff, and the last one is gaps regarding digital competence. So from the gaps among students. During the research, a lot of students say that they are not comfortable in helping peers in needs. That's because there is no, like we say, there is a no formal mental health first aid training, and also there is no integration of mental health education within curricula. Among staff, there is a lack of knowledge related to mental health issues, and it's also important to note that most of mental health first aid trainings and policies are referring to students' mental health, often leaving staff ill-equipped to deal with their own struggles. And regarding the gaps on digital skills, there is a limited use of digital technologies and tools for mental health support in a lot of countries, and also low digital literacy sometimes in both students and staff. All of these insights directly inform the guide. We are currently working on the guide for staff and educators. That is one of the main results from the project. We are already, the first version has already reviewed internally and externally, and we are working on the final version that will be available on MindGuard website, and it will be free, of course. Is a set of guidelines and tips for implementing preventive mental health measures, delivering virtual reality-based training that is not about creating new training, but is about how to integrate virtual reality technologies into existing educational practices, and finally promoting mental health and well-being through the development of digital skills. What comes next? The next phase of the project focus on action. So we will develop the training program, and in parallel, the virtual reality platform will be created to host realistic scenario designed to simulate real life situation, allowing users to practice supportive responses in a safe environment. And from the dissemination side, we will also have another MindGuard webinar, a more interactive one during the All Digital Weeks in March, from 9 to 25 March. And if you are interested to join us, or if you're interested in MindFuard Project, I will also recommend you to follow MindFuard social media profiles and the MindFuard website. Thank you for your attention.
Thank you, Martina. So we have a few minutes for questions. If anybody in the room would like to take the word. Maybe I can get things started. Because I did have a question maybe for both speakers. I heard that from what Tania mentioned, that this holistic approach is necessary and to really achieve good like support for and of course in the role of higher education institutes, the role that they play as as platforms for student well-being, and this holistic approach. And it seems to me that um, Martina's project also kind of caters to this with the guide. I was wondering if there are any practical tips that you might give us on how institutions can approach this. How can they bring about this holistic approach? Who would like to take the
Sorry,
word?
Martina was out of the room for some technical issues, and she's back. Maybe you could
She's
repeat
back.
the question
Yes.
again. Yeah, thank you.
Yeah, I had a question for both speakers, but um, I just wanted to say that Tania emphasized that higher education institutions are this platform where student well-being really plays a role, and that they can take a role in supporting student well-being, but that a kind of holistic approach is necessary. So I was wondering, in both your research and the project activities, if you've come across kind of best practices or things that institutions can get started with if they don't have this holistic approach yet. I don't know, maybe Tania, if you
Yeah,
have an idea about this.
sure. Thank you. Well, yeah, I mean, well-being it's a very complex concept, and as you said, in this holistic approach, because it seems like the well-being is not only mental well-being, it's also social well-being, it is physical well-being. So far institutions sometimes the well-being support services that bring are the main to tackle maybe mental well-being, psychological well-being, more focus on that, and sometimes trying to tackle or to approach in a holistic way, provide with some provision. I mean, I've seen some institutions trying to focus on this holistic approach, providing with resources to improve every dimension of well-being, ranging from social well-being to physical well-being to mental well-being. However, there is very few research and very few approaches regarding of the causes that impact, or the challenges that the students have impacted their well-being within their academic context, which now in turns involve as well digital practices. So when institutions miss to have this point of view in order to create the support services or structures or policies that improve or support the well-being of students, I feel like this holistic approach is not complete because they miss all these points of view. So we do have some tips overall to improve well-being, but when you also tackle the cause of that impact, or that the impacted well-being, that could offer a better outcome regarding the well-being. So that is one of the things that we aim to do, to provide policies, to provide better practices in order not to improve a well-being which is already decreased within the academic community, but in order to improve, to overcome those challenges that both students and educators face within the academic context and academic environments.
Mm-hmm. Thank you. Martina, do you still want to jump in on
Yes.
the guide? Yeah, go ahead.
Regarding the guide, yes. It 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 means to provide specific guidelines on how you can address some mental health issues, and also we have some inside the guide. There are some scenarios with disease like anxiety and personality disorders.
Mm-hmm.
So yeah, it should be practical.
Yeah. It feels in a way that we're just getting started on this subject, like starting to recognize the issues and looking for how do we fit this into something sustainable and durable in our institutions. So I remember, Martina, because you had to sign off quite soon. No? Yeah. Thank you so much for joining us. But I think the next part of our webinar today is a more interactive session. So in this project, specifically on HealthyMindEd, we will use the comments and feedback today to develop a platform. So this was also the reason why we asked you to have some concrete suggestions here. And Shireen, I think our audience can also subscribe to certain information on HealthyMindEd, right?
Yes, indeed. I shared my screen with you. You can just scan the QR code. You'll find yourself in HealthyMindEd website where you can subscribe for our update list. We'll send you any update about the project regarding either the results or any article published and any events that we schedule. And yes, you can also read about our previous articles and how the project have been going so far, and also our colleagues and contributors to this project.